So we found that the ASD, the Autism Spectrum Disorder, and the developmental and language delay groups do not greatly differ in their developmental quotient scores, with the exception of receptive language at 24 months of age. So the results suggest that children with a milder or a broader form of ASD may be misdiagnosed as developmentally or language delayed at 18 and 24 months due to the similarity in presentation in cognitive development. However, poor receptive language skills may serve as an additional red flag for ASD in children who are showing developmental and or language delays at 24 months of age. So we really feel that this is something that should be looked alongside social and communication deficits or language deficits. Okay, so what were the specific behavioural items or the behavioural markers of autism at 12, 18 and 24 months of age? Now, as 9 of the 10 12-month-olds were showing signs of an ASD, I was unable to compare the children with developmental language delay to the autism groups. However, I'll present some data on the percentage of present and absent behaviours in the autism groups relative to a sample of 13 typically developing 12-month-olds. So as you can see from the graph, 89% of the children with an ASD were not pointing at 12 months of age, while only 8% of the typically developing children were not pointing, suggesting that this is an extremely important marker at 12 months. Waving and imitation were also infrequently seen in the autism groups. Now, what was interesting is that while eye contact was recorded as absent for all of the children with AD at 12 months, it was only absent in 17% of those with the milder ASD. Social smiles in response to name call were also absent for all of the children with autistic disorder, but only absent for 33% of children who met criteria for ASD. Now, as there were more children referred at 18 months of age, I will compare the percentage response for each of the items for the developmental and language delay group and the autism groups combined to indicate which items are more specific to autism as opposed to a developmental or language delay. So as you can see, lack of pointing and eye contact at 18 months can differentiate the developmental and language delay and ASD groups quite clearly. Social communication, which we defined as communicating socially with someone by showing objects to them, so showing them their favourite car, showing them a toy, is seen to become a very important marker for distinguishing between children with developmental and language delay and ASD at 18 months, as none of the children in the developmental and language delay group were showing deficits in this area, as opposed to 79% of the autism groups. What was also interesting is that although a high percentage of children in the autism groups did not display pretend play, you can also see that over 50% of the children with a developmental and language delay also did not engage in pretend play at 18 months. So at 18 months in our sample, it was not a marker for autism at 18 months. Okay, so at 24 months of age, there were sufficient numbers in each of the developmental and language delay and the autism groups to run logistic regression analyses in order to determine which behavioural items were best at predicting group membership into the autism and non-autism groups. The final model was significant and allowed prediction of 92.9% of cases. Now, although at 18 months, a deficit in pretend play was not a key marker for an ASD, you can see here that at 24 months, it is one of the most important predictors for a diagnostic classification of an ASD. Now, this is because the percentage of children with a developmental and language delay who had deficits in this area dropped from 56% to 10% between 18 and 24 months of age. Other significant predictors included deficits in pointing, eye contact, and social communication, which is consistent with the findings at 12 and 18 months of age. Okay, so monitoring early markers of ASDs at each of the consultations undertaken at MCH centres was successful in identifying children with autism as well as children with developmental and language delay, albeit smaller percentage. So these items can therefore be used during level 1 surveillance. The specific items discussed could then be used during level 2 surveillance to more accurately identify those children with an autism spectrum disorder. Now, it was clearly seen that pointing and eye contact were very important markers of an ASD diagnosis across all of the ages, and social communication or showing behaviours became very important at differentiating the children with and without autism at 18 and 24 months of age. So this is the first large-scale study to demonstrate that it is possible to prospectively identify infants at risk for autistic disorder and autism spectrum disorder in a community-based sample as early as 12 months. The repeated monitoring of children from 8 to 24 months of age, unlike previous studies that have screened children at only one time point, has resulted in a high ascertainment rate with few false positives. So there should therefore be a move away from a screening model, which is performed once off at a given age, and towards a surveillance model, where developmental surveillance is conducted on all children by healthcare workers to identify signs of abnormal development, but focusing specifically on the early signs of autism, which importantly differ at each age. So there is literature out there advocating developmental surveillance for general developmental problems, but we do really feel that we can conduct developmental surveillance for autism-specific behaviours to pick them up early, as we heard from Sally, because early intervention really does maximise developmental outcomes for children and their families. So thank you very much.